Also, in physical exam, papillary changes. It's important component of a neurological examination. Examined for size and shape, the pupil size and shape. في اختصار نحكي عنه بيريلا. The pupil should be equal, rounded, reactive to light and accommodation. reactive to light يعني إذا شعينا ضوء بشكل oblique على البيوبل راح يصير في pupil constriction، وبالمقابل second eye من دون ما نشع عليها الضوء راح يصير في عليها pupil constriction أو meiosis لأنهم متصلات with the same optic nerve, oculomotor nerve responsible for the both eyes. Accommodation change the gaze from near to far object. راح يتحول بؤبة من from far to near object، بخلي المريض يركز على اشي بعيد وبعدين يركز على شيء قريب مثل الإصبع. changing the gaze from far to near object راح يحول البيوبل من انه يكون mydriasis متوسع الى meiosis متضيق constricted. Regarding diagnostic procedure, CT scan, which provide X-ray pass through the tissues and measure the density there. As the area dense, skull, reflected by white color that appear on the film. As the density decrease, in case of air, the darker appear on the film. Detailed picture of the brain and its component, used to assess for skull fracture, swelling, hematoma, tumor, and abscess. MRI magnetic resonance image اللي هو صورة الرنين المغناطيسي provide more fine details صورة أدق وبتعطي تفاصيل أكثر. used for diagnosis of small lesions that not appear on CT scan مثل cerebral infection, infarction, small area infarction. Limitation cannot be used for patients with metallic material like pacemaker, surgical clips, prosthetic implant, زرعات metallic, patient with life support equipment. Angiography عملية قسطرة الشرايين to indicate if there is an obstruction in the cranial vessels. Aneurysm اللي هو dilated sac at the wall of the vessels. Radiographic catheter to the arteries that bring blood to brain, then contrast dye injected نشع من ضخ مادة ملونة, then image taken and we can then visualize the lumen size حجم وفي obstruction ولا ما في والكلوت ممكن تنسحب بالقسطرة. طبعا لها indication لها criteria out of the scope of this book and this lecture. Myelography, contrast inserted in CSF, then image taken. We can use this picture to indicate the herniated disc, spinal cord tumor, trauma, congenital problems. For contrast or before giving contrast for any patient, we have to check kidney function test, and if we have a problem in the kidney, we cannot provide the patient with contrast because this may lead to renal failure. EEG electroencephalogram, a test used to record the brain activity. Electrode placed on the scalp, waveform appear on the machine. Used mostly for patient with to diagnose patient with seizure and used to confirm brain death because it records the electrical activity of the brain. Lumbar puncture used to detect the presence of infection or hemorrhage. Inserting needle between L3-4 L4-5 lumbar يعني. Fluid sent for analysis, culture and sensitivity. The patient should assume a specific position, bringing his or her knees toward the abdomen. Support needed. The patient should still immobilize during the procedure. For children, we need to control the movement of the child. No movement during the procedure because the needle will insert it in a sensitive area. The complication for the procedure: leakage of CSF, خروج CSF من مكانه, headache, ankle rigidity, fever, difficulty voiding after the procedure.